Organization Profiling Report. Development Organization Type. Local Government Unit. Non-Government Organization. Research and Development Institute. Name of Development Organization. World Health Organization. Vision. All people everywhere will have access to a skilled, motivated, and supported health worker within a robust health system. Mission. To advocate and catalyze global and country actions to resolve the human resources for health crisis. To support the achievement of the health-related Millennium Development Goals and Health for All. Goals. Contribute to health system strengthening and prevent corruption by promoting good governance in the pharmaceutical sector. Mandate of the organization. Advocating for universal health care, monitoring public health risk, coordinating responses to health emergencies, and promoting human health and well-being. It provides technical assistance to countries, sets international health standards and guidelines, and collects data on global health issues through the World Health Survey. Provides expert assessments of global health topics and health statistics on all nations. Organization Profiling Report. Name of the Development Organization. World Health Organization. Organization chart contextualizing the communication unit. World Health Organization. Dr. Harsh Bardhan, Chairman.
Organizational Profiling Report. Development-oriented communication. Materials produced. Types and communication materials. Real objectives. Alphabet board, laptop, cell phone, publication, printed materials, leaflets, pamphlets, visuals, bulletin boards, radios, and television. Models: linear, interactional, transactional, and interactive. Spatial: interpersonal, graphic materials, and signage systems. Temporal: internet files, recycle bins, and signage. Spatial or temporal: online media, interpersonal, interactional, transactional, graphic materials, and signage systems. Timeless: media education, network-based learning, human-to-human communication, ng communication. Right. Time-bound: strategic approach, aims, and objectives. Next is evidence of organizations' communication materials produced.
Women's, children's, and adolescents. Youth violence is a global public health problem. It includes a range of acts from bullying and physical fighting to more severe sexual and physical assault to homicide. Adolescents' pregnancies are a global problem that occurs in high, middle, and low-income countries. Around the world, adolescents' pregnancies are more likely to occur in marginalized communities, commonly driven by poverty and lack of education and employment opportunity. COVID-19. Informing populations about the health risks posed by COVID-19, as well as measures they can take to protect themselves, is the key to mitigating spread and reducing the likelihood that people will become infected. The provision of accurate, timely, and frequent information in the language that people to understand. Variable channels enables populations to make decisions and adopt positive behaviors to protect themselves and their loved ones from disease such as COVID-19. Information is the most important source of enable and populations to make informed decisions on how to take care of their health and to prevent rumors and misinformation. Timely evidence-based information is the best vaccine against rumors and misinformation. Poliomyelitis, commonly called polio, is a highly infectious disease caused by the poliomyelitis virus. The vast majority of poliovirus infections do not produce symptoms, but 5 to 10 out of 100 people infected with polio may have some symptoms like flu. In 1 in 200 cases, the virus destroys parts of the nervous system, causing permanent paralysis in the legs or arms.
The second exercise is the situation analysis, the key issues, and communication gaps. The development organization is the World Health Organization, or WHO. The project goal is the monitoring, evaluation, and review component. The key development issues is the census of population and housing. The communication gap is the M&E component should include reference and use of census that should be ideally be held every 12 years and can provide vital statistical data. The second is the civil registration and vital statistics systems. The communication gap is the M&E component should include a statement on the use of vital statistics and on planned ways to improve the availability and quality of data on birth, deaths, and causes of death. The third one is the population-based health surveys. And the communication gap is the M&E plan should include a health survey plan, integrated with the national statistic plans with specific details on contents, funding, and execution. The third one is the facility-generated data. The M&E plan should be specific about how the facility provides regular quality information for the core indicators. What complementary data will be collected through facility assessments and other ways of data validation. And the administrative data sources and the communication gap is the M&E plan should include specific plans for annual reporting of expenditures by major program and the causes of death through existing civil registration systems, and the communication gap is the strengthening vital event monitoring.
Country-led national plan for population-based health surveys. Harmonizing health surveys. Timeliness, completeness, and quality facilitated generated data. This should be complemented by a systematic annual facility assessment of service readiness and record reviews for selected indicators to fill data gaps and to verify the quality of routinely reported data that goes into progress and performance reports. Tracking financial resource flows and expenditures to subnational levels, human resources systems, and logistics management systems. Improve administrative data sources. Progress towards NHS goals. The M&E should measure the extent to which the objectives and goals of the NHS have been attained. Equity. The M&E should measure progress in terms of distribution of the health system goals. Efficiency. M&E should measure the extent to which the resources used by the health system have produced the maximum possible benefit to society.
Situation analysis, stakeholders profile. Name of development organization, the World Health Organization or WHO Development Oriented Program. Its primary stakeholder, Dr. Harsh Bardhan. You can contact this number 011 2394649 or 237-94640. Location in New Delhi. Education Zakir Hossain, Delhi College, University of Delhi, Ganesh Shanpur, Vidyarthi Memorial Medical College o Kanpur University. Livelihood o employment, otolaryngologist, politician, audience segmentation, primary and secondary stakeholders. And after is the evidence of the group, which is the pictures.
Good morning, ma'am. Our last report is about the tracing the multimedia development process, appraising the material. So, name of development organization, we choose World Health Organization or WHO. So, the development-oriented communication material that we selected is audiovisual. So first is technical description or technical qualities. So World Health Organization has 10 core life skill strategies and techniques as problem solving, critical thinking, effective communication skills, decision making, creative thinking, interpersonal relationship skills, self-awareness building skills, empathy, and coping with stress and emotions. So the World Health Organization has undertaken a project to develop an instrument for measuring quality of life. So quality of life is defined as an individual's perception of their position in life in the context of the culture and value systems in which they live and in relation to their goals, expectations, standards, and concerns. So second is substantial description or substantial qualities. Key message. Cost-effective public health and intersectoral strategies and interventions exist to promote, protect, and restore mental health. Treatment or approach. World Health Organization has evaluated evidence for promoting mental health and is working with governments to disseminate this information and to integrate effective strategies into policies and plans. Awareness of what to do about the escalating burden of mental disorders has improved substantially over the past decade. There is a growing body of evidence demonstrating both the efficacy and cost-effectiveness of key interventions for priority mental disorders in countries at different levels of economic development. Planning or design phase. So message design, World Health Organization will continue to build its capacities to collect and analyze health information to assist with decision making for effective emergency programs, technical prioritization, accountability to affected populations, resource mobilization, as well as promoting World Health Organization's profile and linkages with partners and other stakeholders. Materials design. WHO will continue to advocate on the right to health, particularly in light of the frequent attacks on health workers, health facilities, and patients in many conflicts. World Health Organization will also finalize and promote a methodology to better document such attacks. World Health Organization will lend its voice for more consistently to other pressing issues when they arise, such as impediments to humanitarian access for the provision of health services and the underfunding of the health sector in many emergencies and disasters. World Health Organization will continue to play a vital role in ensuring that the health sector is represented in major global and regional interagency partnerships, initiatives, and platforms, and that health and health outcomes are positioned centrally. as the Global Health Agency and the Health Cluster Lead Agency, World Health Organization has a special responsibility to regularly draw the attention of governments, donors, media, and the public to the pressing need for stronger national EDRM capacities for health and to specific health issues related to humanitarian emergencies. Production planning. In 2013, the World Health Assembly approved a comprehensive mental health action plan for 2013 to 2020. The plan is commitment by all World Health Organization's member states to take specific actions to improve mental health and contribute to the attainment of a set of global targets. So it focuses on four key objectives: to strengthen effective leadership and governance for mental health, to provide comprehensive, integrated, and responsive mental health and social care services in community-based settings, to implement strategies for promotion and prevention in mental health, and strengthen information systems, evidence, and research for mental health. Production phase. Actual production. World Health Organization supports governments in the goal of strengthening and promoting mental health. In order to achieve its objectives, the action plan proposes and requires clear actions for governments, international partners, and for World Health Organization. World Health Organization catalyzes collective action by tapping partners including those of the GHC, FMT program, standby partners, and others. World Health Organization always applies a long-term approach that emphasizes recovery, resilience, and linkages to development actors and programs in countries with large refugee populations. World Health Organization works to reinforce national health care systems to handle the additional patient burden.
There are three important aspects of a plan that requires evaluation. These are the development process and the merit or value of the policy and plan, implementation of the plan, and the extent to which the policy objectives are achieved. Pre-testing. Question number 1. Location, sex of the interviewee age, level of education, interviewee occupation. Question number 2. Have you ever heard about the mental health disorders? Answers: choose one answer, yes or no. Question number 3. What do you know about the mental health disorders? Choose the best answer. I don't know anything. It's a trend that can cause serious damage. It's a government's program. It's a TV radio campaign, or other. Question number 4. What do you think are the examples of having a mental health illness? Depression, anxiety, eating disorders, panic attacks, active athlete, self-harming, and stress. Question number 5. Who do you think is at highest risk to experience mental health disorder? Mark all those you think are more likely to experience mental disorders. Children under 3 years old, adolescents up to 15 years old, youth, adults, college students, elderly persons, pregnant women. Distribution. The action plan was developed in response to the growing burden of mental health disorders and the challenges that health systems around the world are facing to respond to the needs of people with mental health problems. The action plan is a landmark achievement that focuses international attention on a long neglected problem and is firmly rooted in the principles of human rights. A world in which mental health is valued, promoted, and protected. Mental health disorders are prevented, and individuals affected by these disorders are able to exercise the full range of human rights and access high quality, culturally appropriate health and social care in a timely way to promote recovery, all in order to attain the highest possible level of health and participate fully in society and at work free from stigmatization and discrimination. Poor mental health is also associated with rapid social change, stressful work conditions, gender discrimination, social exclusion, unhealthy lifestyle, physical ill health, and human rights violations. As a result, mental health promotion should be mainstreamed in governmental and non-governmental policies and programs. In addition to the health sector, it is essential to involve the education, labor, justice, transport, environment, housing, and welfare sectors. There are specific ways to promote mental health, such as early childhood interventions, faster volunteering and helpfulness, support to children. Programs targets are vulnerable people, including minors, indigenous people, migrants, and people affected by conflicts and disasters. Mental health promotional activities in schools, mental health interventions at work, community development programs, poverty reduction and social protection for the poor, anti-discrimination laws and campaigns, promotion of the rights, opportunities, and care of individuals with mental disorders.
Evaluation phase, targets and indicators. Strengthen effective leadership and governance for mental health. Target 1.1. 80% of countries will have developed or updated their policy or plan for mental health in line with international and regional human rights instruments. Indicators. 80% of countries will have developed or updated their policy or plan for mental health in line with international and regional human rights instruments. Target 1.2. 50% of countries will have developed or updated their laws for mental health in line with international and regional human rights instruments. Indicators. Existence of national law covering mental health that is in line with international human rights instrument. Provide a comprehensive, integrated, and responsive mental health and social care services in community-based settings. Target 2.1. 20% increase in service coverage for severe mental disorders. Indicators. Proportion of persons with a severe mental disorder, psychosis, bipolar affective disorder, moderate severe depression who are using services in 80%. Implement strategies for promotion and prevention in mental health. Target 3.1. 80% of countries will have at least 2 functioning national multi-sectoral mental health promotion and prevention programs. Indicators. Functioning programs of multi-sectoral mental health promotion and prevention in existence. Target 3.2. 10% reduction in the rate of suicide in countries. Indicators. Number of suicide deaths per year per 100,000 population. Strengthen information systems, evidence, and research for mental health. Target number 4. 80% of countries will be routinely collecting and reporting at least a core set of mental health indicators every 2 years through their national health and social information systems. Indicators. Core set of identified and agreed mentors' health indicators routinely collected, reported every 2 years. Data sources and gathering methods. Health brochures in local hospitals, doctor's office or community health center, telephone helpline such as nurse on call or direct line, your doctor or pharmacist. Reliable health information websites such as government sites, condition-specific sites, support organization sites, and medical journals. Data are crucial in improving health. They are the essential starting point, telling us how many people are suffering from various diseases and what health services are lacking. However, the use of statistics must be both reliable and relevant. Key data available from Target 1.1 to Target 4 strengthen effective leadership and governance for mental health, provide comprehensive and integrated and responsive mental health and social care services in community-based settings, implement strategies for promotion and prevention in mental health, and strengthen information systems, evidence, and research for mental health. Gathering methods followed to assist the national health information systems were drawn from a complete analysis of the knowledge landscapes in the World Health Organizations around the world. As regards the health information systems in Table 1.1, 80% of countries will have developed or updated their policy or plan for mental health in line with international and regional human rights instruments. And in Table 1.2, 50% of countries will have developed or updated their law for mental health in lines with international or regional human rights instruments. In Table 2.1, 20% increase in service coverage for severe mental disorders. In Table 3.1, 80% of countries will have at least 2 functioning national multisectoral mental health promotion and prevention programs. In Table 3.2, 10% reduction in the rate of suicide in countries. In Table 4, 80% of countries will be routinely collecting and reporting at least a core set of mental health indicators every 2 years through their national health and social information systems. Data analysis. Monitoring the health situations, the trends, progress, and performance of health systems requires data from multiple sources and a wide variety of health topics. A core component of World Health Organization support to member states is to strengthen their capacity to collect, compile, manage, analyze, and use health data mainly derived from population-based sources. The household surveys, civil registration systems of vital events, and institution-based sources. Administrative and operational activities of institutions such as health facilities. A technical package of 5 essential interventions with the key elements to strengthen country health data and information systems and enable governments to track progress towards health-related SDGs and national and subnational priorities. Here are the syntheses. Since the beginning of the 21st century, there has been a major increase in research into the effects of the arts on health and well-being. This has occurred alongside developments in practice and policy activities in different member states across the World Health Organization, European region, and farther afield. And however, because of lack of awareness of the evidence underpinning these activities, there has been little consistency in policy development across different member states and regions. This report, the field of arts and health. It uses multidisciplinary and intersectoral sources of evidence to support policy making. The Health Evidence Network, or the HEN, has supported and strengthened the use of evidence in the health policy making in World Health Organization since 2003. This synthesis report series responds to public health questions by summarizing the best available global and local findings from peer-reviewed and great literature, as well as policy options and proposes general directions, strategies, and action for consideration. These resources has been developed for outline key approaches, methods, and consideration for a HEN evidence synthesis to support the systematic and routine use of the best available evidence for decision-making relevant to the needs of public health decision-makers. It proposes approaches that hold both scientific rigor and practical applicability for individuals and institutions that perform, commissions, review, or publish evidence. Support to children, example is the life skills programs, the child and youth development programs targeted at vulnerable people, including the minorities, the indigenous people, the migrants, and people affected by conflicts and disasters. Example is the psychosocial interventions after disasters. The mental health promotions activities in schools, such as programs involving supportive ecological changes in schools. The mental health intervention at work, example is the stress prevention programs, violence prevention programs, such as reducing availability of alcohol and access to arms, community development programs, such as integrated rural development, poverty reduction and social protection for the poor, anti-discrimination laws and campaigns, promotion of the rights, opportunities, and care of individuals with mental disorders. The actual production. WHO supports governments in the goal of strengthening and promoting mental health. In order to achieve its objectives, the action plan proposes and requires clear actions for governments, international partners, and for WHO. Ministries of Health will need to take a leadership role, and WHO will work with them and with international and national partners, including the civil society, to implement the plan. As there is no action that fits all countries, each government will need to adapt the action plan to its specific national circumstances. WHO catalyzes collective actions by tapping partners, including those of the GHC, VMT program, standby partners, and others. WHO always applies a long-term approach that emphasizes recovery, resilience, and linkages to developed actors and programs. In countries with large refugee populations, WHO works to reinforce national healthcare systems to handle the additional patient burden.